Myanmar is a country in transition. After years of military rule and being isolated from the world for almost 60 years, this country of 52 million population is in dire need of reforms and development. Its healthcare in particular has been suffering very badly due to half a century of neglect. In a 2013 World Health Organization report, Burma came last on a list of 190 countries for overall health system performance. Recognizing this need of making health accessible and affordable, the member states of the World Health Organization committed in 2005 to develop their health financing systems.
Making good quality care accessible and affordable to everyone, and not just to wealthy people living in urban areas. Having enough facilities available in the right places, with enough well-trained staff, uninterrupted supplies of essential medicines.
With the current healthcare system in Myanmar, how can the government make free, essential medicines universally accessible? Presented here is the problem tree, showing the main causes and impacts of insufficient access to essential medicine in Myanmar. Essential medicine is defined by WHO as drugs that satisfy the healthcare needs of the majority of the population. They should be available at all times, in adequate amounts, and in appropriate dosage forms at a price that the community can afford. Thus, provision of essential medicines is one of the cost-effective measures in improving a health system, and its potential health impact is remarkable. The impacts brought about by this problem are poor health outcomes, high out-of-pocket health expenditure, and increase in number of people under the poverty line. The top causes of morbidity and mortality in Myanmar are communicable diseases in nature such as tuberculosis, pneumonia, diarrhea, malaria, and HIV. Furthermore, the country's maternal mortality rate is so high that 200 mothers die in every 100,000 live births. With better access to essential drugs, the country would have better health outcomes in the future. Another impact of insufficient access to essential medicines is an exceptionally high out-of-pocket health expenses for the households in Myanmar. In 2012, it contributed to 71% of the total health expenditures of the country. Despite its gradual decline from 81 to 71% over the period of 2 decades, Myanmar still remains in the top 5 countries globally, which have the highest out-of-pocket expenses as a share of total health expenditure. In general, the bulk of these expenses are used for purchasing medicines. The third impact of insufficient access to essential medicines is that more people would fall under the poverty line. Globally, about 150 million people suffer from financial catastrophe annually, and 100 million have been pushed below the poverty line due to inadequate healthcare financing. In Myanmar, a study in 2007 showed that approximately 30% of Myanmar households have a huge risk of falling into extreme poverty caused by catastrophic health expenditure. This drove many people to borrow money from others, as they were trapped in heavy debts. Now we know that insufficient access to essential medicines results in various social and economic impediments in Myanmar. What then has caused this huge problem? First, it is an underdeveloped public health financing system. Myanmar's total health expenditure as a percentage of GDP is the lowest in Asia, which is at 1.7% in 2011. The government spends the bulk of their budget on military operations, while the budget on the purchase of essential medicines and medical goods is inadequate to meet the country's demand. In addition, the government has no national health insurance, which is a social net protection, especially for the poorer members of society. The second cause is the inadequate supply of essential medicines. Myanmar's medicine demand relies heavily on imported products from India, Bangladesh, China, Thailand, Indonesia, Pakistan and Vietnam. The country imports around 5,000 types of medicines per year, according to Myanmar's Ministry of Commerce. The market of domestic products is also small, due to underdeveloped production facilities and R&D. Development of medicines from local traditional herbs is a huge potential. However, this resource is still untapped for now. Furthermore, the procurement process of medicines is prolonged and lacks transparency. Another cause is the inefficient implementation of the health policies. Such phenomenon are linked with lack of health manpower, especially in the rural areas, geographic difficulties in prompt delivery of goods and services, and poor monitoring and evaluation of ongoing programs and activities. The total health workforce of Myanmar is only 1.5 for every 1,000 population. It is still far below the global standard of 2.3. Moreover, the terrain and the poor road and transportation facilities in the remote areas obstruct the distribution of essential medicines to those locations. Lastly, another cause is the misallocation of local and international aid. This is brought by the lack of collaboration with the donors, the lack of integrity with the strategies of the Myanmar government, and the lack of trust in the bureaucratic system's transparency and accountability. Other countries have already developed ways to address these limitations, and Myanmar can learn from their experiences. One of the innovations of the Philippines is the promotion of village drug outlets called Botika ng Barangay. These are managed by community organizations or local government units and aim to promote equity in health services by providing low-cost, essential medicines, especially in the rural areas. In addition, the country also developed policies such as the Generics Act and the Cheaper Medicines Act, which helped in significantly reducing the price of essential medicines. The Malaysian government has promoted the use of generic medicines to protect its low-middle-income population and those who are not under the National Health Insurance and Social Protection. The generic medicines in Malaysia are much cheaper in about 27 to 90% of the cases compared to the original branded medicines. Furthermore, the existence of generic medicines has reduced the cost of out-of-pocket expenditures to about 60%. India has championed in regulating the prices of essential drugs in the market. The government implemented an act which defined a minimum percentage of profit margin for a list of drugs in different categories. The objective of this policy was to make certain drugs affordable to the population while making sure manufacturers received reasonable returns. In addition, the country has a National Illness Assistance Fund, which assists in medical expenses of some life-threatening illnesses for people below the poverty line. How then can Myanmar improve its access to essential medicines? Here are some recommendations. First is to increase the budget for health expenditures. All countries, either rich or poor, struggle to raise the funds required to pay for the health services that their people need. However, they could increase their health revenue by increasing the average share of government spending on health. This can be done by cutting down spending in other sectors, such as the budget for military operations. Another way is to find new methods to raise funds, such as improvement in revenue collection and promoting excise tax on tobacco, alcohol, and unhealthy food. External financial assistance is another way to finance health. Development assistance for health from richer to poorer countries have been increasing significantly. Next is the improvement and development of health policies. Myanmar has a very weak national drug law policy, dating way back to 1992. In order for the country to be self-sufficient in pharmaceutical production, it has to amend or formulate a new, rational and coherent drug policy. In the experience of other countries, such as India, Malaysia, and the Philippines, including a direct price control in their policies, led to a substantial reduction of medicine prices in the market. Finally, the country has to start developing their national healthcare insurance system. This is one of the effective safety nets to protect individuals from the huge burden of out-of-pocket expenditures from catastrophic illnesses.